metformin. In this video, we will discuss various important points related to metformin. But before we start discussing metformin, we should have a quick look at type 2 diabetes. Our body needs energy to work, and that energy comes from our cells when they metabolize sugar molecules and convert them into energy. For sugar molecules to enter into the cells, they need insulin. In other words, we can say insulin works as a key for these sugar molecules. But what will happen if there is very less insulin or our cells refuse to accept this insulin? When there is no insulin or our cells refuse to accept this insulin, then sugar molecules can't get into the cells and generate energy. Slowly these sugar molecules start accumulating in our blood and our blood sugar levels are raised, which then causes a lot of health problems. This situation is called type 2 diabetes. There are many factors that can lead to type 2 diabetes, but some important ones are obesity or being overweight, lack of physical activity, and genetic factors. Common signs and symptoms of diabetes are increased thirst, frequent urination, especially at night time, feeling weak and tired at all the times, slow wound healing. If your blood sugar levels are not managed properly, then they can create a lot of other health issues such as heart problems, kidney problems, eye damage, nerve damage, swelling in the limbs, and skin conditions. If taken properly, metformin can be very effective in controlling our blood sugar levels and can help avoid all these health problems. So the first point is, how does metformin work? Metformin can work by 3 different mechanisms. Firstly, it reduces the production of glucose by our liver. Secondly, it increases the insulin sensitivity, which in turn helps our cells to consume more sugar molecules from our blood and producing energy. And the third point is, it also delays the absorption of glucose from our gut. Metformin is available in both liquid and tablet forms, and depending on your country, it may be available under any of these different brand names. If you are taking metformin, let me know which one of these brands are you taking and did you have a positive or negative experience with it? The second point is metformin right for you? Metformin is a prescription control medicine and should only be taken as prescribed by your healthcare provider. If you have any of the following issues, then you should tell this to your doctor. If you have any allergies to metformin in the past, any existing heart conditions, if you have any liver or kidney disease, if you lost too much water from your body, like dehydration, that can happen due to long-lasting or severe diarrhea, if you drink a lot of alcohol, if you are suffering from a severe lung or kidney infection or getting a surgery soon, then your doctor might also ask you to stop the medicine for a while. So the third point is metformin safe in pregnancy or breastfeeding? See, pregnancy and breastfeeding is a tricky situation. If you are pregnant or planning to have a baby soon, then you should seek your doctor's advice before taking metformin. Safety of metformin in pregnant women has not been completely established. Some reports say it is safe to take metformin during pregnancy, but some of them say insulin treatment is a preferred one. So based on your individual health conditions, your doctor can make the best decision for you. But there are high chances that your doctor will replace the metformin with insulin while you are pregnant. In case of breastfeeding, a very small amount of metformin can go into the breast milk. So caution should be taken in this case. You should talk to your doctor and they will decide whether to replace the metformin with insulin or any other alternative drug that cannot harm your baby. For more information, you can read these wonderful articles on this issue. I will leave the link in the description box. Fourth point is interaction of metformin with any other medicines. Metformin can interact with certain medications. So if you are taking any other medicines, then you should tell that to your doctor so they can make an informed decision for you. Here are some medication categories that are known to interact with metformin. Some other medicines that are used to treat diabetes, when they are taken together with metformin, they can lead to hypoglycemia or low blood sugar. Some steroids and hormone treatments, including birth control pills, can also affect its action. Medicines used for heart-related issues and to treat blood pressure. Some of the diuretics can cause dehydration, which can eventually result into lactic acidosis. List of all these medicines that can interact with metformin is provided here. You can also download this list from the description or comment interaction. I will send this list to you. Next point is, what is the correct dose of metformin? Metformin tablets are available in multiple strengths. A common starting dose is 500 mg that is taken once daily, generally after the breakfast. Your dose is usually decided by a blood test known as HbA1c. The maximum dose of metformin for diabetes is 2000 mg per day, that is usually taken in divided doses. Metformin is also available in both immediate release and slow release preparations. So how long does it take to work? It can take 1 to 2 weeks for metformin to improve your blood sugar. Your doctor will likely repeat blood tests after about 3 months to assess its effectiveness and consider dose adjustments. How and when to take metformin tablets? You can take metformin tablets with food. This can help reduce the digestion-related side effects of metformin. Do not crush or chew the tablet. Swallow each tablet with a glass of water. As a general thing, you should always take your medicine on the same time every day. This reduces the fluctuation in the concentration of medicine in your blood. What foods you should avoid if you are taking metformin? When you are suffering from diabetes, you should closely watch your diet and try to limit the intake of any sugary foods, especially cakes, sugary drinks, and fruit juices. Controlling and planning your diet can help you stay away from long-term complications associated with diabetes. Now this is the most important one. Can I drink alcohol with this medication? As per the patient information sheet provided in the medicine box, it is safe to drink a little bit of alcohol while you are on metformin. However, it is advisable not to drink alcohol while you are taking any medicines. Too much alcohol while taking metformin can lead to your blood sugar becoming too low and causing hypoglycemia. Or it can result in dehydration, which can lead to a serious side effect of metformin that is called lactic acidosis. What should you do if you missed a dose? If you forgot to take your medicine, you can take it as soon as you remember. But if it is almost the time for your next dose, then you should skip the missed dose and then remember to take your next dose at a regular time. You should never take a double dose to make up for a missed dose. What should you do if you accidentally taken too much of this medication? If you have accidentally taken too much of this medicine, then you should immediately talk to your doctor. Overdose of this medicine can cause lactic acidosis, which can be life-threatening. How long do you need to take this medicine? You see, diabetes is a very stubborn condition. You can control it by proper care and medication, but it is very hard to treat it completely, and you might need to take this medicine for life. You should keep taking this medicine until your doctor advises you to stop it or change your medicine. If you take care of your diet, maintain a good and healthy lifestyle, then you may be able to control your blood sugar levels in a healthy range. Then you might be able to reduce the dose or completely stop it with your doctor's advice. But it requires a lot of patience, commitment, and discipline. Now this is the most important part if you are taking metformin, that is related to side effects of metformin. Just like any other medicine, metformin too has some side effects. Not all people will experience these side effects, but some of them do. During the initial few days of this medicine, some people can experience nausea, vomiting, stomachache, diarrhea, reduced appetite, or metallic taste in the mouth. These side effects generally go away after a week or two. You can also try taking this medicine with food to reduce the digestion-related side effects. If these side effects do not go away after a few days, then you can talk to your doctor so they can suggest some tips or switch to a slow release version of metformin tablet, which are a bit expensive but are better tolerated. Less common but serious side effects. Few individuals can experience some serious side effects like skin rash or itching, swelling in the face, lips and mouth, difficulty in breathing, soreness to your mouth and tongue, development of mouth ulcers, muscle weakness, lactic acidosis, which is a buildup of lactic acid in your blood, which can be life-threatening. Symptoms to watch for this condition are feeling generally unwell with severe tiredness or sleepiness, altered breathing patterns, including slow heartbeat, yellowing of your skin or eyes, suggesting possible liver inflammation. Some people ask this question a lot. Does metformin can cause hypoglycemia? Metformin itself typically doesn't cause low blood sugar. However, many people with type 2 diabetes take other medications like insulin or glycoside that can cause hypoglycemia. If you are taking any other anti-diabetic medicine, then it is important to be aware of early warning signs of low blood sugar, which include poor concentration, confusion and sweating, shaking or trembling, feeling hungry, feeling dizzy or even fainting. If you experience hypoglycemia, you can consume a fast-acting carbohydrate like fruit juice to raise your blood sugar quickly. You should also discuss this issue with your doctor so they can adjust your dose or can provide some other tips to avoid these issues in future. Some people also ask this question: does metformin cause vitamin B12 deficiency? Metformin can in some cases reduce the amount of vitamin B12 your body absorbs. This is a rare side effect, but doctors may recommend monitoring vitamin B12 levels, especially with long-term use of metformin. Symptoms of vitamin B12 deficiency include fatigue and lethargy, pins and needle sensation in your limbs, muscle weakness and mouth sores. I hope you found this video helpful like my previous videos. If you have any specific questions, please read the patient information leaflet provided in the description or leave your questions in the comment section. I will try to reply to your questions as soon as I can. Please hit the like button and subscribe to my channel for more such informative videos. Thank you.